It's a tiny bit.
Okay, everybody, welcome to the next in our Functional Wellness Community Forums. Just to recap everybody on what the heck it is we're doing here. Complete Wellness is doing 3 community forums every week. It's our desire, it's a result of our desire to serve the community even a little bit better, even a little bit more deeply. So these community forums are for patients and non-patients alike. There is no charge for these. People can come on, listen, ask questions, be involved at whatever level they would like. Monday night, 7:45 to 8:15 is the coaching forum, live with the coach, Dr. Daniel Fenster. I've heard he's an amazing coach. Coaching is about getting you from one level of your life to the next level of your life that you desire, that you might be having trouble getting to. That's Monday nights, 7:45. Tuesday nights, tonight, 7:45 to 8:15 is the Functional Wellness Community Forum with the lovely Diana Orchant, our functional wellness nutritionist. I heard you say that today. I like that title.
Thanks.
Where we'll be discussing all things wellness, functional wellness, improved lifestyle, just trying to get you to be the best version of yourself in all things wellness. And Wednesday nights, 7:45 to 8:15, the community forum there is, we actually have it titled as stress management, but I don't actually like that name. What I like much better is building stress resistance. And we build stress resistance with Jan, and she teaches you how to do that with both breathing, meditation, mindfulness, all sorts of tricks that she has up her sleeves. And believe me, she has many. So tonight at the Functional Wellness Community Forum, we're going to discuss, Diana and I, and we welcome any and all questions at any point. You can type them into the chat. You can, I don't know, raise your hand. I'm not exactly sure how this is done. But we're going to discuss all things gut. Everything you ever needed to know about the gut in the next 27 minutes and 45 seconds. Ready to roll, Diana?
I'm ready.
So I think first it is important to define what the gut is. People talk about the gut all the time. Oh, I know I got to take care of my gut. I need probiotics for my gut. Well, what actually is the gut?
Yeah, that's a very good question. So the gut is essentially where it's another word for our microbiome. So it's filled with tons and tons of good bacteria.
Well, one second.
Yeah.
Where is that located?
It's
the
our
microbiome.
Good question. It's in our small and large intestines.
In our small and our large intestines. So just to recap, it would have been nice to have a little picture. The small intestine begins right at the end of the stomach, and it's that very, very small squiggly stuff. I forget the length, very technical term, squiggly stuff. I forget how long the small intestine is, but it's long.
Really long,
It's really long.
I don't know the number either, but it's many feet.
It's really, really long. And then the small intestine proceeds into the large intestine, and that's that very large structure that goes across your abdomen, first up the right side and then across and then down your left side. So it's in sort of an inverted U.
Exactly. And
Great.
so the small and the large intestine are filled with tons of bacteria. They're also, and that some of it's good, some of it's not so great. The goal is to get it all to be commensal and work together. But it's where a lot of health begins, but also where disease begins.
I'm old, but when I was a kid, we would say, oh my God, bacteria inside of you. That sounds so bad. That's not good. But you're saying it is good.
We are filled with, I wish I had the exact number, but we are filled with billions of little bacteria that make us up.
Wow. Those bacteria are supposed to be there. Yes?
They are, yes. They're important. You don't want to wipe them out, which is what antibiotics do.
We'll get to that.
Yeah.
So this bacteria is good and it's supposed to be there.
Yes. And
what is it supposed to do? Or what does it do?
It helps support our immune system. It helps keep our entire system in check. It helps us digest and absorb our foods. It creates, what else does it do? It
creates neurotransmitters.
Yes, it creates neurotransmitters, which if you have
read that online. No, I'm kidding.
No, if you have anxiety or depression, a lot of times people also have gut issues because you don't have enough of those good bacteria to create these.
Okay. So we're supposed to have these bacteria inside our large and small intestine, and it helps us process food, and it also produces all these things that we need for human existence.
Yes, and then they're all kept in there through our gut lining.
How come we don't, this sounds like a ridiculous question and a disgusting question. How come we don't poop them out?
That's a good question.
Uh-oh, I stumped Diana.
I mean, technically, though, we do, right? That's how you use a stool sample and you're able to see what kind of bacteria lie in the gut. It's just that there's so many of them, but you do excrete certain particles that allow us to be able to test your stool, which we'll go into, and you can actually see what kind of bacteria lies in the gut.
How does the bacteria get in there? Are we born with it?
A lot of it, yes. It gets passed down from your mother's mother. So I always say feed your microbiome now because it's going to affect your offspring's offspring. So a lot of it is hereditary, but it's also...
Now I'm really confused. How does it get in there? Really? Seriously?
Because what your mother got was from her mother. And when you're in the womb, that's when it all starts beginning. That's when you start getting all those microbes.
So you're not conceived with it, but you receive it from your mother through the umbilical cord while you're in the... That's interesting. Yeah. I never thought about that before. That means it's going into you through your bloodstream?
That's a good question.
This is above my pay grade.
I can tell you it's hereditary.
That makes sense, but I'd like to look more into that. That's an interesting question that I just asked.
You're right. Like how does it physically actually happen?
How does it physically actually happen? We'll get back to you next week on that question.
Yeah.
Okay. So we have this bacteria. It got there. We inherited it from our mother's mother.
And you get it through your diet too. Your diet can very much change your microbiome.
So you're not born with a fixed amount.
No, it can absolutely change, but genetics does play a role.
Got it. And then you just alluded to good bacteria and bad bacteria.
Yes. What's
that about?
We have commensal bacteria or like normal bacteria flora, which an easy way to think of it, I always say, is kind of like the probiotics, right? These are the good bacteria in the gut. If you're taking probiotics, you're likely adding more of that good commensal bacteria to your system. There's quote unquote bad bacteria, which we've heard of, right? E. coli, salmonella, Shigella, like all these crazy foodborne illnesses, right? And that's
all
what if you
these
go to a regular, all the Ellas. And that's what they'll test for if you go to a regular GI doc. But then there's also what is known as like pathogenic bacteria, where they're bacteria that are causing issues and symptoms without causing disease. But we don't want there to be too much of them.
Wait, we want bacteria.
Yes.
We want a lot of
certain strains more than others.
But we don't want too much of the good bacteria, because that's also a problem.
Yep.
How do you monitor how much bacteria you have? How do you know if you have too little, too much, just the right amount?
You'll be symptomatic if you have too much or too little. So symptomatic meaning that you have a lot of belching, acid reflux, you might have a lot of bloating or gas or diarrhea or constipation, right? You're going to have symptoms. You also could have symptoms on the surface. So that's usually when the body is really crying for help, which is like acne, rosacea, psoriasis.
On the surface meaning the skin.
Yes.
1 second. The bacteria in my gut affects my skin.
Yes.
How does that work?
There are certain strains that are tied to specific conditions. SIBO, psoriasis.
What is SIBO?
Small intestinal bacterial overgrowth. So that's when there's too much of the good or the bad bacteria that creeps up from the colon into our small intestine. A lot of this lives in our colon.
To have,
but you want most of this to be in the colon. And when too many of these microbes.
What's the colon?
The colon is the large intestine.
The large intestine.
And when too many of these bacteria sneak into the small intestine, there's a problem.
How could that happen?
There's a lot of ways that it can happen. It can happen through poor diet. It can happen through low stomach acid, so not having enough acid that your stomach produces. It can happen from various environmental or toxin exposures. It can happen through stress, and it can happen through various medications as well.
Wow, this is complicated.
It is. There's a lot.
You must be a very smart person. So a person has issues. Let's just call a vague description of issues with their gut, whether it's the small intestine, the large intestine, too much bacteria, too little bacteria, no bacteria because they took antibiotics.
And don't forget fungi, yeast, parasites, those guys too.
Wow. How would I know that I'm having an issue? You mentioned bloating.
Skin infections or skin issues.
But aren't there lots of times you could have gut issues without skin issues? And aren't there lots of times when you have skin issues without gut issues?
More common that you might have gut issues without skin issues, but it can affect our joints. It can affect our mood. There's not anybody who couldn't benefit from looking into the gut and seeing the makeup of it, because when you optimize what's down there, you often feel a lot better.
Gotcha.
Whether it be, even joint pain, even headaches, like it's crazy how much the gut can impact global symptoms. Hormonal imbalances too. Could
you explain some of those? It sort of makes sense that if someone's gonna have a gut imbalance, just call that, they'll have digestive issues, constipation, diarrhea, bloating, gas. That's right in there.
Yep, exactly. And that's where the disconnect is when people have something else that's not digestion related, but we're still like, we should see what's going on in the gut. So there are certain symptoms that we would consider, like hormonal imbalance is a great example. Estrogen is one of the hormones, but many hormones get detoxified out through the gut. And there are certain
many hormones get detoxified out through the gut.
through our stool.
Why would we want to detoxify out a hormone?
Because we're exposed to, I mean, we could go really down a rabbit hole here, but we're exposed to so many different.
Make it a small rabbit hole.
we could have a hormonal imbalance for one reason or another, right? It could be you're exposed to xenoestrogens, which we've talked about before, or it could be that there's just you might have PCOS, right? Some of that's hereditary. Whatever it is, it can cause an imbalance, maybe too much testosterone, maybe too much estrogen. And so we need to be constantly detoxifying out excess hormones. You also could be taking a medication like birth control, which would increase your hormone levels as well.
Oh, so we would want to get rid of excess hormones. If the body's creating too much for some reason, it goes out through the colon.
Exactly.
And into the toilet. Got it. So it's not a normal thing that we would want to get rid of hormones. It's because there would be excess.
Yes, but you also just want to be like circulating through them, right? So like when a woman is ovulating, estrogen should actually go to decrease, right? And so we want to be detoxifying that out through the system. And the same would be when a woman, it has their menstrual cycle, right? Estrogen and progesterone are at their lowest. So we want to make sure we're kind of like recycling through those.
So you started to touch upon skin issues, what you called surface issues. Interesting way to call the skin. We have a question.
I always say it's coming up to the surface.
Got it. What about keratosis pilaris?
That's a good question. So for those who don't know, keratosis pilaris is often that kind of bumps, almost like chicken skin that frequently shows up on the back of the arms, but it can be almost anywhere. And with keratosis
is it
pilaris,
more prone in women or either way?
It's more prone in women, but men can easily have it. Yeah. With that, I actually, there could definitely be a gut imbalance, but I actually think more about omega-3s, so good quality fats, and vitamin A. Vitamin A actually helps the skin turn over. And with keratosis pilaris, we often need vitamin A. So my favorite either supplement, or if you want to eat a lot of this, is like cod liver oil, because it's got a lot of those omega-3s and it's got vitamin A. And sometimes that just nips keratosis pilaris in the bud.
Great question. Thank you, Elizabeth Reagan Delgado. Okay, let's go back to the gut and hormones and where were we headed?
Joint pain, we were saying.
Yeah, so how does the person get joint pain from their gut?
So oftentimes there's a correlation with eating a lot of inflammatory foods, right? And what's inflammatory for you might be different than what's inflammatory for me. But
what are the top 3 most common inflammatory foods?
Gluten, dairy, sugar, added sugar.
Gluten? I don't know. I heard this whole gluten thing is BS. Seriously.
The issue with gluten in America, well, I could go on and on about gluten in America. And I say America specifically because a lot of people go overseas and they're totally fine. But there's a lot of herbicides called glyphosate, which may or may not be the problem that's very toxic. Our wheat is over hybridized so that one slice of bread contains more gluten than ever before. And then on top of that, gluten triggers a protein called zonulin in many people with any kind of gut issues that opens up the gut lining and allows food to pass through, aka leaky gut. But that's why gluten can be such a problem.
So
that's one of many reasons.
Gluten is complex, meaning it's not just.
We could do a whole episode on gluten.
Say it again?
We could do a whole episode on gluten.
Let's do that. But the point is, it's not just gluten. It's the herbicides. It's the processing.
Yes.
It's not just the gluten per se.
Exactly.
Okay. Let's keep going with that about how gut issues can cause joint problems. However, we have a question from Facebook that we should answer. How does coffee affect the gut? One of my favorite subjects.
You want to answer that one?
No.
So it depends on the person, right? If you look into genetics, you can see that
I'm
some
curious.
people.
I'm just interested. I'm thinking that what I think that person actually might be asking is, why do they go to the bathroom when they have coffee?
Got it. Well, so this still goes along this line in that some people are faster metabolizers of caffeine than others, meaning those people can have caffeine at midnight and not be, and it'll go right through them, and they won't necessarily feel like they're awake, feel stimulated from it the same way.
When you said it'll go right through them, you didn't mean like
I meant like the caffeine gets metabolized quickly, but caffeine itself can actually like push things through a little bit quicker.
Got it.
So if you're somebody who runs to the bathroom after having coffee, you might want to try having your coffee with breakfast or after breakfast, not before.
So that they don't run to the bathroom?
Yeah, it can definitely help as opposed to like having it right upon waking on an empty stomach.
Gotcha. I hope that answers your question. Asker of question on Instagram. Oh, I said Facebook, but it says Instagram there. Okay, so going back to how gut issues and inflammation can affect the joints.
So again, a lot of this comes from inflammatory foods. Inflammatory foods increase the bad bacteria of the gut. They cause what's known as dysbiosis, where there's less good bacteria and too much bad bacteria or yeast or fungi or parasites, right? So that has a huge role there. And what's interesting is when individuals have a poor diet, it impacts their gut, but it also can impact more systemically. And so we see that some of these inflammatory foods actually do cause joint pain, back pain, knee pain, you name it. And when you sometimes remove these foods or eat less of them even, joint pain subsides and gut health improves.
So needless to say, gut health affects so many things. And one of the things that really screws up gut health is antibiotics.
Antibiotics, I'm going to add to that list.
Please.
Proton pump inhibitors or acid blockers.
What is that?
It's what people take often for acid reflux, and it decreases stomach acid.
Like Pepcid?
Yes. Pepcid, Zantac, any of the Prozols, omeprazole.
Any of those purple pills.
Yeah. And Advil or ibuprofen in general too.
How does Advil or ibuprofen screw up your gut?
It can cause more either GI bleeding or like ulcers, which would cause GI bleeding.
And that's actually pretty well-known stuff. That's why they talk about not taking that ongoingly.
Right. That's a well-known one. But people don't think about it when they pop Advil all the
time. So what should someone do if they have to take an antibiotic?
So if you have to take an antibiotic, then you want to get on a probiotic, specifically a blend or at least one that contains Saccharomyces boulardii, which is a probiotic strain. It's a yeast. It's actually a good yeast that is known to fight off some of the yeast. Because if you've ever taken antibiotics, especially if you're a female, a lot of women go through this like yeast infection, bacterial infection, yeast, and that's because when antibiotics are taken, it can increase or stimulate some of the yeast to overgrowth. So taking Saccharomyces boulardii will help kill off or at least fight some of that yeast from growing. But then also just a good broad spectrum probiotic with bifidobacteria, lactobacillus can also help make sure that the antibiotic doesn't overkill a lot of those good bacteria. Because remember, antibiotics go in and kill the good and the bad.
Question: do you recommend avoiding Advil altogether?
If you're prone, but if you're prone to stomach ulcers, I'd probably minimize it. But no, it's not harmful if you're not taking it all the time.
Yeah, I mean, I would say in general, you want to avoid it, but altogether sounds, like
Don't make yourself
an,
nuts.
yeah, don't make yourself nuts. It sounds like an absolute statement, an absolute statement. I mean, I take an Advil when I drink too much before I go to sleep. That's not that often. So it's a good tool to have in your toolbox, but like all tools, don't overuse them or abuse them because it'll have a side effect. Do I take an occasional Advil? Absolutely. I
Rec for
think
an
if you
alternative.
say it again,
We've been asked for a rec for an alternative. I'm happy to answer that one. So it depends what the issue is, what's hurting, right? So if it's like joints, then I would think about turmeric, boswellia, ginger, that type of thing, which a lot of people with kind of chronic pain will go down that route. Versus if you have like a headache, you might want to focus on like ginger and butterbur, things like that. I can get more detail into that. But there's depending on what's happening, you might want to use different alternatives. But turmeric, boswellia, ginger, good across the board.
do you see that question from Elizabeth Reagan?
No, I don't know what you're saying.
On the topic of yeast,
oh yeah,
can you explain yeast extract that is often added to foods?
If you have yeast overgrowth and you're trying to kill it, yeah, I would definitely watch out for yeast extract. If you don't have an issue, what?
Is it I mean, it sounds like a silly question, but it's worth asking. Are those the same kind of yeasts?
Yes, there's tons of different types of yeast. There's even some controversy on nutritional yeast, which is like healthy yeast if you have any yeast overgrowth. So yes, if you feel like you suffer from yeast overgrowth, maybe it's even just around your menstrual cycle or any time of the month, then you might want to watch out for like added sugars and added yeasts.
And yeast thrives on sugar.
It does. Exactly.
So therefore, you would want to stay away from refined sugar. Is that right? Yes. Would you want to stay away from carbohydrates?
Not stay away from, but depending on how severe the yeast is, when you go in with antifungals, we'll use antifungal herbs if someone has yeast overgrowth, then you can still have some level of complex carbohydrates for sure. You might just want to watch out and maybe not have them at every single meal.
And if you're having yeast issues, would you also want to stay away from alcohol?
Yes.
Why?
Well, first of all, alcohol can increase gut permeability or leaky gut, which one day we'll go into. But also it ferments the same way, right? So yeast will definitely feed off of alcohol.
Got it. Since we're on the topic of yeast, do men suffer from yeast infections like women?
Yes, but it's more common to see it on the skin in men.
Like a yeast infection visible on the skin?
Mm-hmm.
What does that look like?
A lot of times for men, when they sweat, they might get like kind of these red dots on their chest or on their arms. It could also be like a fungal infection on the toes. But yeah, I see more commonly that fungal infections affect men on the skin.
Wow, crazy. This is complicated.
I know, we could talk about this for hours.
Well, we just spoke about it for 29 minutes. And I like to keep within our time frame. But I think this is a topic that we're going to have to stay with for a couple of weeks to really talk it through. So I think that next week we should continue the conversation about gut. Perhaps people can come with questions at the beginning of the next session.
Yeah.
Next Tuesday night at 7:45, we could sort of include that in our general discussion. But
if you can't come or you want to watch the replay, then you can direct message either Complete Wellness or me, and we'll make sure to answer those questions for you.
Awesome idea. So we're going to continue the gut discussion for at least one more week, maybe a couple more weeks. And we've got to get into something that's very, I'm going to say controversial, which is leaky gut syndrome. You've been hearing about it probably if you're reading anything, but or watching Facebook or Instagram. There's a lot of ads for supplements around leaky gut. So we got a lot to talk about. So we're going to stay with this topic for a long time. So thank you, Diana.
Thank you.
I'm going to let you get to your dinner. Very informative as always. Thank you, everybody, for joining. Thank you for being here. And tomorrow night, 7:45, building stress resilience. Monday, coaching. Tuesday, functional wellness. Wednesday, building stress resilience, all at 7:45. Thank you again, Diana. Thank you, everybody. Have a great night.
Thank you, everyone. Bye.